Good morning and welcome to this morning's webinar being hosted by the Virginia Hospital and Healthcare Association. My name is Abraham Segrist and I'm the Vice President for Quality and Patient Safety here at the VHHA, and it's a pleasure to have so many of our colleagues from across the Commonwealth joining us for this call this morning. Before we get started, I would like to review a few housekeeping notes. All participants are in listen-only mode for the webinar. Our apologies for any technical difficulties you had calling in this morning, but hopefully most of you were able to join and listen in via your computer audio. If you do have questions or would like to make comments throughout the webinar, please do so by typing those questions or comments in the question box in your control panel for the webinar. This morning's webinar is being recorded, and the slides and a link to the recording of the webinar will be shared with each of you that are registered for the webinar and will also be posted on the VHHA's Quality and Patient Safety website. At the conclusion of this morning's webinar, a brief feedback survey will be launched that we hope you would take a few minutes to give us feedback on the webinar and how we may be able to assist you going forward. So today's agenda, I will provide a brief overview of the VHHA and the objectives for this morning's webinar. And then we will hear from the current chair of the VHHA Board of Directors, Dr. Michael McDermott from Mary Washington Healthcare in Fredericksburg, Virginia. And then one of our partners here at the VHHA, Ms. Carrie Brady, will provide a brief overview of trends in patient experience in Virginia. We'll review some of the activities we've been engaged in with you all over the past few years and how we hope to engage with you throughout the year of 2020. And then there will be an opportunity to respond to any questions you might have entered in the chat box before we conclude at 10:30. So the Virginia Hospital and Healthcare Association, for those of you that are not familiar with the organization, we are an alliance of hospitals and health delivery systems that represents over 110 hospitals across the state of Virginia. The vision statement for the association is that through the power of collaboration, the association will be a recognized driving force behind making Virginia the healthiest state in the nation. The mission statement for the organization is also listed on your screen. And as you can see, the association's leadership is focused on improving access to care, continuing efforts to improve healthcare safety, quality, and service, promoting a vibrant, high-value healthcare system, and advancing population health to promote health and economic opportunity for all Virginians. The members of the VHHA include the organizations listed on your screen. So our 110 hospitals are represented by these 26 health systems across Virginia, from Augusta Health over in Fishersville, Virginia, up to the Inova Health System based out of Fairfax, Virginia, over to Lake Taylor Transitional Care Hospital in Norfolk, and then to Virginia Hospital Center up in Arlington. So we are an alliance that represents all of you that are on the call with us this morning, and we're glad to have you with us. The objectives for today's webinar are as follows. 1, review the goals for the VHHA's 2020 Year of Patient Experience. What is the objective and why did we decide to declare this the Year of Patient Experience? Secondly, to provide each of you with an overview of statewide trends related to patient experience. And then finally, to solicit your input and feedback regarding your patient experience improvement efforts and how we can be of further assistance to you. So the Year of Patient Experience in Virginia. Our goals for this initiative are as follows. 1, we want to identify, highlight, and celebrate efforts in Virginia hospitals and health systems to improve patient experience of care. You all have been working on this for quite some time, and we simply want to be able to highlight and share the great work that's already occurring across Virginia. Secondly, we want to continue to encourage all of us to link and integrate your patient experience improvement efforts with your broader quality and patient safety improvement efforts. We recognize that from an organizational structure standpoint, these functions might sit in different places in the organization. However, at its core, they're all connected and should be integrated. Thirdly, we want to connect you with each other. We want to facilitate connections between Virginia hospitals and health systems and other stakeholders for the purpose of shared learning. We understand that many of you are making great progress, but we do believe that by working together, we can accelerate the rate of that improvement. And then finally, we want to make sure we support efforts collectively and individually to help improve your performance on HCAHPS and other national patient experience performance measures within your facility and across the state as a whole. So with that as a backdrop, I would like to introduce Dr. Michael McDermott. He's the president and CEO of Mary Washington Healthcare, located again in Fredericksburg, Virginia, and he also currently serves as the chair of the VHHA Board of Directors, who will provide his insights regarding the importance of patient experience for Virginia hospitals and health systems. Dr. McDermott?
Thank you, Abraham. Good morning, everybody. And thanks to everyone for joining the call. I'd like to share a few of my thoughts regarding the importance of patient experience in healthcare. At Mary Washington Healthcare, we've directed our attention and have made focused efforts to improve our patient experience. And last year, we made a declaration that 2019 was going to be the year of patient experience for Mary Washington Healthcare. As we rolled into 2020, we also unveiled to our entire crew that works here at the healthcare system that 2020 is also the year of patient experience at Mary Washington Healthcare. This is one of those journeys that we're on, very similar to our high reliability journey, where the journey never ends and that we can always be better and provide better experiences for our patients. And it's something that we want to continue to focus on. And so why do we focus on improving our patient experience? And I think there's a couple of answers to that. First, I think it's just the right thing to do. It's simply how any of us would like to be treated if the shoe was on the other foot and we were the patient. But also, compassionate care, it creates a culture of positivity that improves our care environment. And I think it leads to better outcomes. It also can lower the costs of our healthcare system. It reduces staff turnover, it decreases length of stay for our patients, and it also leads to fewer errors because of the culture that it creates in our healthcare system. It also helps us prevent burnout of our workforce, which we know is a very important issue for all of us. So how are we doing overall in the United States with our United States healthcare system with patient experience? And I think there's an important thing to realize when we try and reflect on how are we doing. When you ask caregivers and providers how we're doing with patient experience, we tend to rate ourselves very high. We think we provide a great experience. But when you ask patients how are we doing, they rate us significantly lower. And I think there is a gap there that we need to recognize and address and improve upon. I agree with James Merlino, Dr. Merlino from the Cleveland Clinic, and he talks about patient experiences. It's not about making patients happy. It's really about fulfilling the patient promise of delivering safe, high quality care where the patients and their families feel that we care for them. That's really what patient experience is all about. It's about compassion, and it's about authenticity. It's about genuine connections, and it's about empathy. And so to improve the patient experience, I think we need to refocus on how we connect with our patients and their families. And I believe we can all change the culture of healthcare in Virginia by committing to improve the experience of our patients. And we'll do that by connecting with our patients and their families through those genuine and compassionate interactions. And I'm proud of the work that we've done here at Mary Washington Healthcare addressing our patient experience. In 2019, Press Ganey placed Mary Washington Hospital in the top 10% of all hospitals on the rate of improvement for patient experience. So this is something that we can all do together. I want to thank everybody for their commitment to improving patient experience in Virginia in 2020. By working together, I'm confident that we will all accelerate our improvement and create better experiences for our patients. So thank you all for being on the call today.
Well, Dr. McDermott, we certainly thank you for your time and for being with us. We thank you for your leadership on the VHHA Board of Directors and how you rally all of your colleagues and your other CEO partners from around the state to support the association in working with each of your facilities to collaborate as we continue to improve the patient's experience of care. At this time, I would like to introduce my colleague, Ms. Carrie Brady. She is a friend and colleague of the association who's worked with many of you over the past several years on your efforts to improve patient experience. And she also joined us here in Richmond at our Patient Safety Summit last year to lead a statewide discussion around patient experience. So Carrie, I will turn it over to you to provide some insights into the trends in patient experience in Virginia and some of the efforts we hope to undertake together.
Thank you, Abraham. So we wanted to highlight just what the current experience is in Virginia and how performance has been on HCAHPS. I will say HCAHPS is one measure of patient experience, but all of the things that Dr. McDermott just spoke about in terms of our compassionate care and partnering with patients go far beyond what's measured on the current HCAHPS survey. But if you look at the HCAHPS performance in Virginia hospitals, there's been a steady improvement over the years, and it's plateaued a little bit in our most recent 12 months of reporting period that's available. So it's gone up from a 68 to a 72 and then plateaued a little bit, which is not unusual in any kind of improvement initiative that you would see a plateau. But if you look at how the statewide rank has gone compared to other states in the country, you can see that the rank is improving dramatically from 36 of 51 when we first started taking a look at this, and now to 23 of 51. Still not where you want to be in terms of the goal, but definitely improving. And Virginia has been improving at a pace that's greater than other states in the country. So there's that good news to report. We know that when you want to continue improvement, very often the best way to do that is to go back to foundations, because if you can have improvement on various things, but then you will either taper off if it's something that you focused on tools and resources, and that sustainability becomes more difficult. So in the 2020 year of patient experience, what we're asking everyone to do is really shift the way that they're thinking about this to take a more holistic and cultural approach to it. Yes, of course, you're going to continue with your initiatives, and we want to build on that prior work. But we want to take a step back and look at this from that broader perspective that Dr. McDermott just laid out. So we have in the past on improvement guides, we will have statewide data analysis that will continue, but there have been some priority areas that were identified by Virginia hospitals, particularly those participating as your representatives on the Patient Experience Forum. So we know, for example, even in looking at the HCAHPS metrics, that patient and family engagement by being on advisory councils or having representatives that are partnering with hospitals in various initiatives is where Virginia hospitals are performing less well than they are in the other patient and family engagement metrics looked at by the HCAHPS. And so there's an opportunity there for us to integrate with that work and to align with these other initiatives and resources that are available to help improve performance in many different areas, not just on your patient experience metrics. So this isn't a new to-do. We're going to be going back to these foundational elements, which are leadership, patient and family engagement, staff engagement, and effective use of data. These have been shown by the evidence to be very important foundations for success in patient experience. They're also important foundations really for success in any kind of improvement efforts that you'd be undertaking. We wanted to get a sense from you on the call today where you think you have the strongest foundation and where you think you need the most support for these foundations. So we have two polling questions for you. The first one we're going to ask you is, which patient experience foundation is the strongest in your organization? And now everybody will have an opportunity to vote on this, and we'll be able to get the results in real time. It's always interesting when working with organizations to see how these come out. As Dr. McDermott said, we tend to rate ourselves very well in certain areas, but that might not be the experience of our patients. One thing you may want to consider in your organization, however this comes out now on this poll, is asking your staff members the same thing. If you ask a group of staff members, say in a particular department, which foundation they think you need to work on, you may get different areas in different departments of the hospital, and you may be surprised at what you hear when you just do this kind of quick polling to see where people feel the strongest and you can build on that strength, or where they feel they need the most support. Okay, so not surprisingly, because we obviously have engaged leaders on the call today, if you weren't interested in this topic, you wouldn't be on this webinar. 43% of you say leadership is the strongest, but there's a fairly even split between the other three, engagement of patient and family, staff, and effective use of data, which is a wonderful thing to see, because one of the things that we're going to be asking you to do, as Abraham said, is to share with each other where your strengths lie, because we know excellent work is being done in Virginia, and we want to highlight that and spread it statewide. So we will be looking to you, those of you who feel that these areas are the strongest, with what you have to share, and that you would volunteer to share that with your peers, because we know that there's so much to be learned even within the state of Virginia. So thank you for answering that. The second question that we want to ask you is, where do you feel that you need the most support from VHHA in one of these foundational areas? Because we want to make sure that everything we do in this year of patient experience is tailored to where you really need support on a statewide basis. We recognize, of course, that's going to vary hospital to hospital, but we wanted to get a statewide perspective. So Abraham, if you could open up that poll. Excellent. And while you're completing that, one of the things that we'd like to do through these quick webinar series that we're launching is to provide you with some statewide perspective on issues that you may not be able to get anywhere else, because VHHA is uniquely suited to be able to ask statewide questions of organizations and find out how certain things are structured. For example, how do you structure a patient experience? What are the reporting relationships? How does it integrate or not with other departments in the organization? These kinds of structural questions are hard to find answers to statewide. Virginia Hospital Association has the ability to do it. So if there are questions that you would like posed to the state, we're happy to do that. And there will be a question on the quick survey at the end for feedback, asking you what are some things you'd like to know statewide. So we encourage you to do that. I think we're going to have results here in just a second. Okay. So staff engagement comes out far and away the most important thing you'd like support for through this initiative. So as we're designing this webinar series, then we'll make sure that we're providing you with great examples of organizations that feel they're engaging their staff effectively, and how they go about doing that, and some tools and resources in that area. So that gives us some important direction for how to structure this in terms of priorities. And then also effective use of data and patient and family engagement. We have some things planned in those areas as well. Thank you for that. So here's the overview of what we have planned in terms of the outline of VHHA support that you can expect to see in 2020. We will continue to have these 30-minute patient experience success and challenge webinars. As I mentioned, we want to be able to do these pulse surveys on items of interest to you as leaders in this field. So we want to know what you want to know so we can get you that information. After each of the webinars, we're planning to distribute just a quick one-page summary with some highlights and information. So if you weren't able to be on the webinar, or you want to disseminate the information more broadly to your team, we'll make that easy in addition to making slides available. We are working with developing a Patient and Family Advisory Council toolkit. This was requested by the members as a priority area that you'd like some support in. But we know that there are many existing resources out there, so we are not reinventing the wheel. There's one toolkit that was recently developed by the Colorado Hospital Association, who's given permission to all other associations to adapt and make it state-specific. It highlights all of the great existing resources that are available, the best of the best, and we will be working with all of you to put some Virginia hospital examples into that toolkit and disseminating that so that everyone has a ready reference, those of you that haven't built councils yet and want to get started. To that same end, we are partnering with Press Ganey and NRC as your HCAHPS vendors because, again, we don't want to reinvent the wheel. What we want here is to make sure that we are helping all of you get the most from the resources that are available to you. So Press Ganey and NRC are partnering with VHHA in helping us get data from you, helping support you in providing data to VHHA on a more timely basis so that we'll be able to feed that back to you much faster than you're able to get that on Hospital Compare, and that we can see how things are going and identify hospitals, for example, that are showing significant improvement. As Dr. McDermott mentioned, very often when organizations are having a rapid rate of improvement, as Mary Washington was recognized by Press Ganey for, that means something important because you have done something different to cause that rate of improvement. And we really want to learn from those organizations that are improving quickly because there is something that you are doing to have that effect on your organization. So we'll be taking a look at that data. As I said, we're partnering with Press Ganey and NRC, and we also want to be able to build on the tools and resources that they make available to you as their clients, because they do have a wealth of information that's available, and we want to make sure that the right people are getting that information throughout the organization. So we want to get that from them as well. We'll also be disseminating lessons learned from 2 small Studer Group facilitated collaboratives that are happening in Virginia. So we're tapping into lots of different sources of information about improvement and effective strategies that are working on the front line currently in Virginia. So as leaders, we have a few things that we want to ask you to do. One is we want you to think about how you're embedding patient experience within your other initiatives, including quality and safety. Dr. McDermott referenced some of the many examples of how focusing on patient experience has benefits far beyond just improving your HCAHPS performance. It does have an effect on quality, safety outcomes, as well as your staff retention, and just really changes the culture. So as you're developing any initiative, particularly in quality and safety, but really anything you're doing, as leaders, you have the opportunity to set the right tone by asking, have you considered, or how are we partnering with our patients and families in this initiative? Because when you do that, it can change things dramatically. I want to share a quick story with you about a readmission situation. I had an opportunity to work with a hospital, was not in Virginia, to do some focus groups with patients around readmissions. And they found out something that would have taken them a long time to figure out that really addressed a core issue for readmissions. These patients had been readmitted after being discharged from the emergency department. The hospital found out that even though there was a 24-hour pharmacy that had opened right down the road from the hospital, it was very, very close to the hospital, so they thought that it was not hard for patients to be getting their meds after they were discharged from the emergency department. The main issue that came up in that focus group was that for various reasons, sometimes patients took cabs to the ED because they really weren't feeling enough to drive themselves, or they had someone driving them, but it was the middle of the night and they didn't want them to have to make another stop. Even though it was incredibly convenient from the hospital's perspective to be able to get those meds there, many of the patients who were being readmitted simply hadn't stopped at the drugstore to get the meds, even though it was open and it was literally less than half a mile from the emergency department. So by talking to the patients and finding out that that was really the issue, now they could have a different strategy to address those readmissions. Very often, when we ask our patients what's going on, we learn something different than the assumptions that we're making. No matter how hard we're working on an issue, the patients will have a different perspective, and it's an important one for us to consider that can make everything more successful. So as leaders, you can set that right tone by always asking, how are we partnering with our patients and families in this initiative? What is the role for them to have, and have we considered that in everything you're doing? Because when you embed that, it becomes part of the culture and not just this standalone patient experience initiative that you're working on or department that's working on it. It's part of what everyone does. We would also encourage you as leaders to share your successes or challenges with VHHA, as well as those requests for information, so that we can gather that statewide information that you may wish you have as you're making certain decisions. So as leaders, we're really relying on you to move this forward, as you're doing anyway in your organizations, but to just maybe take a slightly different perspective in this year of patient experience about how you embed this in everything that you do. Now I'm going to turn it back over to Abraham to tell you what's coming next.
Thank you very much, Carrie, for that overview. So we've already got several volunteers that have agreed to share with their colleagues across Virginia some of their patient experience successes and challenges. Beginning next month, on the 27th, Mr. Chris Occasion and some of his colleagues from the Bon Secours St. Francis Medical Center here in Richmond will be sharing some of their success stories with their colleagues across Virginia. Then in March, Ms. Nancy Littlefield, the Chief Nursing Officer at Riverside Health System based in Newport News, will be sharing with us. And then in April, Ms. Mary Manick, CEO of Augusta Health, and Ms. Crystal Farmer, CNO of Augusta Health, located in Fishersville, will be sharing some of their success stories. We've got those three lined up, but are very open and invite any of you on the call that have stories you'd like to share with your colleagues. Please reach out to us and volunteer and let us know how we can highlight the great work that we know that you all are undertaking in your particular community. This actually brings us to the end of our scheduled presentation this morning. I'm looking at our question box and I don't see that any questions have been posed. And so I will hope that means that we have addressed the issues that we set out to address and that we've provided you with some insights into why the VHHA has declared 2020 the year of patient experience. We look forward to working with all of you in a number of different venues throughout the year. As Carrie said, at the conclusion of the webinar, a survey will be launched that will ask you to tell us how we can continue to be of assistance to you in this great work. I do see there is one question, and I will try to see if the question that came through was for the polling question, how many people participated? So looks like we had 97 individuals that dialed into this morning's webinar, and if I recall, we had about 78% of the attendees actually respond to the webinar. So hopefully that gives you some sense of the rate of participation to the two polling questions that we had. I'm not seeing any other questions, and we're almost at the end of our time. So I will go ahead and conclude this morning's webinar. Again, we will send a link to the recording and a copy of the slides to all the participants, as well as have them posted on the VHHA's website. Please take a few minutes to complete the brief survey that we will launch at the conclusion of this webinar, and we look forward again to working with you all throughout this year.